Hi, in this video we'd like to talk about another quite rare condition that can affect your fertility, quality of life. This condition is known as transverse vaginal septum. This condition has a very similar cause that can lead to other uterine malformations. For example, septate, didelphys, naïve uterus. The cause is the same thing, but this is a condition that is slightly different. This condition happens in the vaginal opening. There is a transverse growth of a very thick tissue that is blocking the vaginal opening. This tissue is made of connective tissue, and then during fetal development in the early stages of pregnancy, because of the Mullerian ducts failing to fuse together when they are supposed to fuse, but it did not fuse, so it leads to this type of condition. The Mullerian ducts failure to fuse can lead to uterine malformation as well, and in this case, depending on severity, it led to a transverse vaginal septum. Now you can look at this image here that I've put here. Yes, so you see that there's a thick tissue made of connective tissue that is growing along the vaginal opening, and this can cause symptoms. For example, depending on severity, if it's less severe, you will still experience menses. If it's very severe or moderately severe, it can cause amenorrhea, and then due to the buildup of the menstrual blood inside, it can really cause some complications. For example, severe abdominal pains, and you may need some painkillers as well. And it can also affect your sex life, difficulty in intercourse, and then other symptoms as well. So this condition, although rare, it can be diagnosed, and there is treatment for this. Treatment is relatively simple. We simply remove the septum, the tissue that is growing. Depending on severity, we want the vaginal canal to be open and then connected to the cervix, so that we can restore healthy sex life and also fertility capabilities. You can get pregnant after having this condition treated. So diagnosis is key. We use a number of different examinations. For example, we need to do a pelvic examination, we need to do a colposcopy, we might need to do a hysteroscopic diagnosis as well to accurately assess the situation. What kind of severity are we looking at? Is the patient experiencing amenorrhea? What type of surgical intervention is the best approach? But in general, this condition is easily diagnosed and treated. But women need to self-diagnose. If you feel a growth of tissue that is not supposed to be there, if you feel some abnormality, if you feel that during intercourse you're feeling pains and difficulty, these are all causes to get yourself checked. If you feel that you are experiencing no menses at all or severe menses pain without cause, these are all causes for you to go and get yourself checked as well. And with your own diagnosis and our expertise, we can get a proper diagnosis of this transverse vaginal septum and then have it treated. So not to worry, this is a treatable condition. Antai Hospital treats this condition. We can do diagnosis within 1 day and treatment within 3 to 5 days. You can hospitalize within a week, and then your sex life is restored. And if you'd like to get pregnant, you can also do so. So if you'd like to find out more information about this condition and other conditions that we treat here at Antai, visit the website. Also leave me a comment down below.